What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the inmate X-rays you do on people who are incarcerated or are within like police jurisdiction, like cuffed up and stuff like that. So to give you context, I am a night shift X-ray tech. I've been doing it for over 4 years in the great state of Texas. So with these people, usually in the emergency room, the most common times you'll see them, if they are suspected of a DWI, driving while intoxicated, you'll see them cuffed up, mainly just getting blood work done from the nurses. Usually it's not your problem. Sometimes they get into accidents, MVCs, car crashed, and whoever they're bringing in, they're trying to get them checked out before they send them off to jail. Maybe the patient's complain, maybe like the person's complaining about stuff. So you'll go in, do a little X-rays. Once again, you'll be followed by an officer or a sheriff or whoever. Depending if you got to bring them back to the room, they can just chill and back there with you. Sometimes the officer will ask you questions about the X-rays. Other times they're just watching the inmate or whoever, right? Not a problem. Other times, people will be already incarcerated and they'll come in their little orange jumpsuits and you'll have to do a chest X-ray. Just watch out for like the buttons. They have a lot of metal buttons. Sometimes they get into brawls or whatever happens in jail and they come in all messed up, and then maybe you have to do X-rays in certain level of patients, we'll call them, have to be cuffed up due to whatever they did. We don't really ask questions. So sometimes they won't be able to unbuckle them. Maybe the patient's hostile. Maybe, whatever's going on. So sometimes, like if it's a wrist, the best case, you just move the cuff up and down and you just kind of work around it. Other times, if they remove it, the officer has to like stay in the room. Sometimes you can just give them lead. Other times they won't care. It is what it is. Let's see what other stuff. Most of the time it's just chest. Sometimes their abdomen. You have to do some KUBs if they complain. And then a lot of the times it's because they got hurt at the jail from like fighting, or they're going to jail because they got into a brawl or whatever, and they'll be all messed up. And you will hear people intoxicated. You'll always hear a bunch of stuff from people, and you're just like, I'm just trying to do my job, Always. Which I will say, if you're a student, I've seen it many times, especially with some of the ladies. As students, they'll be hyped up about like they get a femur, they get whatever they need, and then they will go into the room and they're like, I wanna get a check off on this one, Miguel. And I'm like, cool. So we go, and it doesn't say like they're inmates or anything, so you don't know. It's just a regular patient. We go in there, and they'll be like in a little jumpsuit, chained up, and it looks intimidating. Some people, I guess, to some students, look intimidating. And then they'll look at me, and then they'll be like, I'm gonna need some help with this. I don't think I can comp it. Or they'll say something to which is kind of acute in my brain. I'm like, okay, maybe they're intimidated, maybe something's going on. Let me take over. I've seen that with some students and stuff like that. Or I'll just try to help them more. That's something that I see a lot, mainly with the ladies who are students, not too much with the dudes, it's whatever. But at the end of the day, I always tell them like, yo, I know you intimidated, but like if you're gonna be doing this, you gotta, regardless of what person you gotta do, you're just trying to do your job and just be careful, but you gotta treat everyone the same, and just kind of work with what you got. My biggest complaint I find with some of the times is the patient's a little hostile and they'll refuse a bunch of things, but since they're going to jail and get cleared, some of the times I've been told that they have to get medically cleared before they go. Even if they say no, you're still doing the stuff. The patient will be hostile. Sometimes the officer will have to hold them down. You'll let up too. Everyone will let up, and we'll have to like force to get the exam. I'm still cool doing that. It's mainly the officers that always give me problems when I'm shooting the X-rays, and they'll come and look, and they'll be in my way of me doing my job because they're there trying to see what's going on and ask me questions about if it's broken, what they're gonna do. Can they see a different view? Can they they start asking me a bunch of questions, and I'm like, sir, you can go talk to the doctor. I'm like, once it starts interfering with my job of me trying to get the most optimal pitch, like, and especially we're super busy, I'm like, sir, respectfully, I don't got time for this. I'm just trying to take the pictures to show the doctor to see what we're going to do. Because, or other times they'll sit there and, I mean, everyone has a job, everyone has something they're trying to do. And sometimes it'll be like a trauma, like level 1, level 2, and the officers will be there. We'll start like trying to help them, the nurses, doctors doing everything, and then the officer will come in, start, talking to the patient, start interrogating them, ask them all these questions, and like the poor person is just like hurting because like their shoulder is destroyed or whatever's going on. The worst one I've seen was someone got a gunshot to their arm, and we were trying to do a humorous and trying our best to shoot. Like, this is like half, like this shit like shattered in the middle, destroyed. So me and the other tech were just struggling to get the most optimal images, and this poor patient struggling, yelling, screaming while being interrogated by the police officer. And like even the nurses were like, sir, officer, can you like give us a second? And apparently, I don't know if there's like a window of time they got to do their stuff, that it will always be interfering with what you're doing. And sometimes I feel like they don't choose the best time to do their interrogation while all this stuff's going on. I'm not sure how their department works, but sometimes it will be in your way. Other times, other officers are very chill and like they're like, yo, do whatever you gotta do. I'll just wait here. Just let me know when you're ready so I can continue my stuff or doing what I gotta do. It all kind of depends on the officers and stuff like that. But overall, it's not too bad. For the most part, it really kind of depends on, like, I've struggled more with the officers than with the actual patients, to be honest with you. But once again, it could be depending on where you work at, depending who's running the joint. My partner here at work, her husband works at the jail, and she tells me a bunch of stories of some of the officers and how they are, and I'm like, makes sense why they act a certain way and cause certain problems when we work. So it really kind of depends, but most of them can be seen in the jail patient-wise. It's just some of the times, if they're really, really bad, they'll show up at your hospital, or if they're causing problems at the hospital and they just don't want to deal with them. Sometimes they'll like get them checked out here just so they get admitted, and so they don't cause problem over there. They're over here, segregated, like separated from everyone else, So, I don't know. You see many things here at work. Good, bad, and all you can do is press your little button and just keep it pushing. Especially at night. I've seen a lot more crazy people coming in from jail during the nighttime. But overall, it's not too bad. Just keep your eye on the swivel when you see people come in, because the worst thing that can happen is you get hurt by one of these people. So always, it's been your boy Miguel. We'll see you on the next one.